Good morning, good afternoon, good evening from wherever you are joining us from. Welcome to today's webinar presentation entitled On Behalf of Me, Myself, and I. My name is Dr. Tashina Reeder, and I am excited that you guys decided to join us to learn about this presentation that will be provided to you by Sky. So before we jump into today's webinar, let me give you a few housekeeping reminders. The chat box has been disabled. However, you can use the Q&A box at the bottom of your screen to ask all of your questions. At the end of the webinar, don't log off. You will be prompted to complete a survey. We want to hear from you to hear your feedback about today's presentation. Okay, so if you have any questions, the Q&A box is down below and the chat has been disabled. So without further ado, I'm going to hand over this presentation to Sky.
Hi everyone. How's everyone doing? Wow, we have a lot of people here. I'm really excited to get to do this workshop for you guys. Um, I'm just looking at the participants. I'm really excited to be here. I'm really excited for you guys to be here. I think we have people from all over the US, and we even have people that are attending from Puerto Rico. We have a lot of organizations in the house. I'm really excited about that. So I'm going to go in and start the workshop. I'm going to share my screen. So I titled this workshop on behalf of me, myself, and I. First, let me real quick just say who I am. My name is Cynthia Vasquez. I've worked as a HIV prevention specialist and education specialist for the last 19 years. Everyone that has worked for me, providers and clients alike, have all called me Sky. So if you know me, you do know me as Sky. Um, and this is the type of work that I love to do. I love to educate. I love research-based workshops. I love to do work in the HIV prevention field, and it's one of my passions. So I'm very excited to incorporate that this year in this workshop particularly. So I titled this workshop on behalf of me, myself, and I. With this workshop, it's a little bit of uh, research-based information on how a client can advocate for themselves in a space where they only kind of speak English and then it's not part of their culture. Also, there's some information for providers on how to manage clients that may be only Spanish speaking and might feel uncomfortable going to your facility. So I will be speaking in Spanish and in English just for the people that only speak Spanish. So again, this is on behalf of me, myself, and I, de parte de mí, de mi persona y yo. Here we go. So if real quick, if everybody could put it in the, I can't see the chat, I don't think, while I'm on sharing the screen, but I would like kind of to know everyone's pastime. I won't go through the names, but I would like everybody just to share what's their favorite pastime. If you like to eat, if you like to read books, just let me know in the question box or in the chat, please. Awesome. So I'm a big couch potato. That's my favorite pastime. I love movies. I love series. I love Netflix. ¿Qué es tu favorito pasatiempo? All right, so let's get right into this. So because we're going to be talking about some heavy, I wouldn't say heavy topics, but I would say serious topics. I just kind of want to mention that laughter is the best medicine. And in Spanish, we have a saying, hay que reírse para no llorar. You have to laugh so that you don't cry. Um, Como vamos a estar hablando de tópicos que son un poco tabú, le quería enseñar esto bien rápido. Esto dice, la risa es la mejor medicina. And I just found this to be incredibly funny and but very, very but that's not it. But I found this to be very true to our culture.
Get you in trouble, and I understand you guys have rules and policies, but he really wants to see his family, and listen, I'll tell you what, I'm gonna make an exception for you. Visiting hours ends in 30 minutes. I'll let you get one more family member in there. He's been an excellent patient, so I'm gonna do that for you, all right? So it's okay if I call my family over so we can. Yeah, yeah, you have the green light. We have the green light for me. Okay. It'll just be one or two people, okay? Hey, ¿cómo tú estás? Mira, me encanta tu outfit. Ricky, ¿todo bien? ¿Todo bien? Bien, bien, bien. Veo la fuerte, la gimnasio. Ani, ella como siempre. Why is your family so big? Just one or two. Man, you guys, it's too many. La doctora, la doctora. Todo bien, todo bien. So don't want to get in trouble. That's too much people. No. Trust me, we'll keep it down. Listen, they're already in here, so please, just keep your voice down. We'll promise we'll be super quiet, okay? Oh, we need you now, all right?
Suavemente, bésame, que quiero sentir tus labios besándome otra vez. Suavemente, bésame, que quiero sentir tus labios besándome otra vez. Suave, bésame, bésame, suave, bésame otra vez. Yo quiero sentir tus labios besándome otra vez. Besa, besa, bésame un poquito. Suave, besa, 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 bésame otro ratito. Pequeña, echarte para acá.
So I hope you guys had a good laugh on that. That made me laugh. I'm pretty sure we all have those type of stories. Oh, and I don't think the next one. Right. I went through the topics. Again, this is more about empowering clients and helping providers empower their clients, specifically clients that are Spanish speaking. Um, so one of the questions that we had is that why do Hispanics and Latinx communities shy away from healthcare settings? ¿Por qué la comunidad hispana y latina se aleja de la atención médica? And a lot of the times, it has to do with culture. There's in certain cultures they have home remedies. En cierta cultura tienen o dependen de remedio caseroso para evitar los costos médicos y porque es algo que ya está acostumbrado. So in the Hispanic and Latinx culture, not only do they rely on home remedies because it's passed down from generation to generation, but it's also because it's cheaper, right? It costs less. Um, Sometimes, a bottle of Vicks costs less than the phlegm medication that they're about to prescribe you at your doctor. Can I go to the next slide, please? Can this video be played real quick? Can't hear it. So in this situation, this character, he has a cold, and his mom comes in with a bottle, a little cap of Vicks. Now, if you are Hispanic, I'm sure you know what Vicks is. For example, remember personally when I was younger, and if I had a cold, they used to put Vicks on me. And even though, that's something that you could get at, even though that's something you could get at the pharmacy, that's something that helps, and it's part of Latino X and Hispanic culture. You could go to the next one, please. So 72 of Hispanics never use prescription drugs, particularly those from indigenous backgrounds. El 72% de hispanos nunca usa medicamentos recetada, especialmente aquellos de origen indígena. Y como dije, la costumbre vale mucho. When it comes to customs and culture, if grandma said, you know what, let me heat you up this tea because that's going to work, they usually respect and pay attention to grandma. Next slide, please. Also, a big thing in Hispanic and Latin culture is the willingness to disclose certain types of information. Sometimes, if a topic is too taboo, for example, anything that has to do with your genitals, usually they don't speak about it. También tópicos que son demasiado de tabú, los hispanos y los latinos no hablan mucho de eso, no hablan de eso ni tan siquiera con familiares o las parejas. So, no, ellos, como es tabú, ellos no le dicen nada a sus doctores. Willingness to disclose information decreased if they did not have if they did not sense that their physician was compassionate. Taboo topics, discomfort with doctors also intensifies when the health topic is culturally taboo, like sexual health and mental illness. Por ejemplo, for example, I know that a lot of women or young girls, when they hit puberty, that is celebrated in Hispanic Latino culture. In Spanish, we call it le cantó el gallo. And that's something that obviously after that, you need care. Um, por ejemplo, cuando a una señorita le go through puberty. I'm not sure I say puberty in Spanish. I had a brain freeze right there. When they go, cuando le cae señorita, eso se celebra entre la madre y la hija. That's kind of celebrated between the mother and the daughter. And usually those stuff we don't talk about. Esa cosa en verdad que no se habla con los doctores. Porque tiene que ver de allá abajo y mucha gente no hablan de eso ni con sus parejas ni con su mamá. Next slide, please. Also, a lot of Hispanic and Latinx individuals shy away from visiting doctors because they say that they're not compassionate. They don't get them, right? And as a provider, we really have to do our due diligence to kind of investigate and just research an individual's culture. Can I get the next slide? I'm not sure. Oh, that was in the Spanish one. So just remember, if you are a provider, if you are a person that's working with other people, it's best to do your due diligence. We're going to speak about that a little bit more later on, but it's best to do your due diligence as a healthcare provider, as an educator, as a person that's just working with other people that speak other languages and have different cultures than yours, so that they could have a level of comfort. um, you will be surprised what a little bit of research in your part can do for a person that's Hispanic and that has a strong Latinx background and culture. Yo creo que es la responsabilidad de uno si tú estás trabajando con otra gente en, en un sitio de doctores o en un lugar donde servicios a otra persona. Usted tiene que tratar de conseguir información de las culturas de otras personas, que no sea de su cultura. Y yo creo que aunque sea un poquitito de información que usted se aprenda, que tenga que ver de la cultura de otra persona, eso llega hasta larga, ¿me entiende? Um, y vamos a hablar de eso un poquito más después. So as we was talking about why certain individuals from the Hispanic and Latinx community that do not go to healthcare providers or healthcare facilities, specifically with men, a lot has to do with this whole concept, this whole stereotype of machismo. And if you don't know what machismo is, in Hispanic and Latinx culture, the man is usually, and this is what it's said, the man is usually the one that goes and works and takes care of everything. Therefore, they cannot afford to get sick, and they kind of see themselves invincible. And they have to take care of the family. Like I said, they can't afford to be sick. They get sick, they don't go to work, they don't get paid. And that is rooted from machismo. And unfortunately, no one's invincible. Individuals do get sick, and we have to see a healthcare professionals. And I think if you understand that as a healthcare provider, you'll kind of see where the Hispanic Latinx male is coming from. And one way you could combat that, get them in and out. We're going to be talking about translation later, but if you have a translator there, just try to get the information quick and now and try to do things as easy as possible for the client. Also, if it's Latinx and Hispanic individuals in impoverished communities, you could see why they won't go to a doctor or try not to go to a place where it's going to cost them a lot. Back to when we was talking about home remedies, like I said, that is cheaper than going to a doctor if they do not have health insurance. A lot of Latinx and Hispanic community do not have health insurance, and it could be for different reasons. Immigration, that can play a big part in the Latinx and Hispanic community about not going to a healthcare facility. And it has, a lot to do with if an individual doesn't think that they have papers, then they will not go because they're scared. So las razones son muchas, pero algunas veces también, I'm just going to say in Spanish real quick, el machismo tiene que ver mucho con un hombre no ir para un doctor, ¿verdad? Si el hombre de la casa no puede trabajar, pues no trae dinero y eso no se puede hacer, right? El hombre tiene que trabajar y el hombre es invisible y no puede, como digo, no puede dejar de trabajar porque ellos tienen que mantener todo mantener su familia. So, el machismo tiene que ver mucho también con porque los hombres no van para el doctor, se sienten que no, yo no me puedo enfermar. También la immigration, si alguien es de otro sitio y son inmigrantes y no tienen papeles, eso puede despejar a alguien que vaya para el doctor porque van a tener miedo o estos doctores me van a preguntar por mis papeles y yo no tengo eso. So, puede ser que no vayan para el doctor por algo así, aunque tengan una fiebre de 1,4, no van para el doctor porque no tienen papeles. So, hay que tener en cuenta nosotros ayudando a la gente de estas cosas. Y the biggest thing is language. There's a language barrier. Sometimes they feel embarrassed that they don't speak English, without knowing that there's resources out there that can help them. También el lenguaje, otra cosa, porque si alguien no sabe mucho el español, um, yo no hablo español perfectamente, pero puedo entender y puedo hablar, pero hay mucha gente que maybe entienden, pero no hablan. Y eso, aunque entienden y no hablan, ellos no van para el doctor porque van a decir, oh, yo no puedo hablar, me van a hacer hablar y tengo mucha vergüenza. Next slide, please. So the lack of information is a big one, right? For example, Latinos with psychological disorders don't contact a mental health specialist as often as they should, or they're not comfortable talking about their mental health issues. That's something that Hispanic families don't really talk about. También en la comunidad hispana no se habla de trastornos psicológicos. So, si alguien latino o hispano tiene un problema que quieren ver a un psicólogo, ellos no, ellos no hablan de eso con la familia, menos que van a hablar con un psicólogo de eso. Y no hablan con sus doctores para que los refieran para un psicólogo. So, hay que también tener eso en cuenta. Hay que sacar mucha información de sus clientes. You as a provider, you're going to have to like kind of pull and keep asking questions to try to get to some certain topics that your client who's Spanish speaking or have a strong Spanish cultural background won't actually say. And also, some Hispanic and Latinos don't really know what an anxiety disorder or depression truly looks like. So some of us in this workshop are Hispanic or come from a Latinx background, culture, or community. I kind of want you to think if you've ever heard specifically, let's talk about males, of a male in your family who has ever said, I'm sad. Los que son latinos aquí, quiero que piensen nada más si han oído a un miembro de su familia decir, y vamos específicamente, estamos hablando de los varones, vamos a ver si en su familia o grupo de amigos que son hispanos, si uno de los varones alguna vez han dicho, me siento triste. I've never heard that in my family. And sometimes that's due to not knowing exactly what that means, what the symptom is. Because if you're sad, you better get up and do what you got to do and you'll get over it. ¿Verdad? Porque a veces pensábamos, si estás triste, mira, ponte a limpiarlo, a hacer algo y vas a estar bien. Que en verdad no se sabe qué es la depresión o la ansiedad. Simplemente se dice, no está bien, no se siente bien, va a estar bien después. So, estas son cosas que hay que considerar explicándole a un cliente. Next slide, please. All All right, so a reason also, maybe we talked about the whole language barrier. También hablamos de lenguaje. Si uno no sabe inglés o en el sitio donde uno vaya no saben inglés, en verdad ellos no, español, ellos no van a ir ahí. So specifically for clients, you want to go to where your people are. All right. The internet is the best tool that we have right now in 2021. You want to go to a place that is maybe geared towards Hispanic, Latinos, or that you know for a fact they speak Spanish. And one of the ways that you could do this is by asking family and friends, where do they go to? You could also contact community organizations that is geared to helping Hispanic and Latinx community and checking out their resources. And if if you have a doctor already, right, and they do not speak Spanish, but you and this person get by, but they kind of really recommend that you see a Spanish speaking doctor, you might want to see if that fits for you. The thing with that is that a lot of Spanish speaking individuals, Hispanic individuals, when they have their doctor, that's their doctor. If the doctor speaks English, if the provider speaks English, that's their person. But you kind of have to realize, well, I need to fight. I need to fight for my health. This is one body that I get, and I need to take care of it. And I'm not getting my information across. I get some information across, but not all of it. And I know you trust your doctor and you want to stay with this doctor, but if your doctor or your provider says, listen, I think you should go to this other person because they speak better your language, or they're from your cultural background, then maybe you should consider going to that other place, because you shouldn't mess with your health and you want to tell your doctor everything. So si un cliente, o si usted eres un cliente y necesita conseguir un alguien que te dé servicio en español o un doctor que hable el lenguaje, lo mejor es tratar de preguntar sus familiares o su amigo en qué hospital, qué doctor o qué servicio ellos están cogiendo, para ver si usted pueda, pueda ir para ese mismo sitio. La cosa es también cuando un doctor o una persona que te esté dando servicio te diga, mire, yo creo que usted es mejor si vaya para otro lugar, porque esta gente son más de la cultura que usted conoce o hablan español. Es mejor que usted tan siquiera vea si eso es para ti, right? Porque uno tiene que en verdad coger lo de la salud y decirle lo que tenga que ver con tu salud, tú solo tienes que decirle a tu doctor y se lo tiene que decir todo. So, yo entiendo si tú te sientes con confianza con la persona que usted tiene ahora, right? Pero si usted no, si nada más el 50% de la información se entiende entre tú y la persona que te está dando servicio, en verdad no vale la pena. Hay muchos sitios también, organizaciones de la comunidad que te pueden decir a dónde puedes ir. Can I get the next slide, please? All right, earlier we were talking about machismo and where does that come from. We talked about the man of the house takes care of things and has to work. El hombre de la casa se ocupa de las cosas y tiene que trabajar, ya hablamos de eso. Como dije ahorita, cualquier persona se puede enfermar. Y usted se tiene que cuidar. Solo tiene que ver de dos formas, right? O te enferma y no puedes trabajar porque estás enfermo y ahí, no puedes cuidar a su familia, o ve para el sitio donde te van a servir, para el doctor, habla con su doctor para que ya pueda estar arreglado y ya puedas ir para atrás para trabajar y cuidar a su familia. So with this whole machismo thing, right, about the man of the house taking care of the house and they don't get sick, the thing is, like I said before, no one's invincible, and you kind of have to put things and shift your perspective a little bit and kind of come at it at a different angle. So, okay, you know, you don't get sick, but let's say if you do, something happens where you get sick. Some men don't like going to the doctors and they just rather stay home and just deal with it. But let's say this. What if you do get sick, right? And or anything happens where you need a service provider? What if that happens, instead of just rocking it out at your house, just, you know, it's best to kind of change your perspective, go to that service provider, go to your doctor, take care of yourself right there and then so you can continue working and taking care of your family. A lot of people like to push through, but pushing through might be your downfall. Mucha gente quiere seguir trabajando aunque esté enfermo, pero ese mismo pensamiento es lo que te puede enfermar. Next slide, please. All right, and this is the big one, right? So anyone, Spanish speaking or not, from any culture, we have to have trust with our service providers. And there's not a lot of trust in the Hispanic and Latinx community with service providers, and that could be for a lot of reasons. But one thing I do want to tell you is that Latinx community and Hispanic communities do not forget. For example, specifically in Puerto Rico, around the 1950s, medical professionals and scientists conducted human trials of birth control in the island of Puerto Rico. Not only did these medical professionals paid women in low to no income families to participate in trials, but they also conducted trials with misinformation and deceptive tactics. Over 1,500 women took the drug over several years. 3 deaths occurred among patients who were taking the birth control drug and during these trials, despite strong circumstantial evidence that the pill was causing these unexpected deaths, they were not reported as those conducted the trial considered the deaths to be coincidental. The ethics surrounding this trial were questioned heavily after the control of the population was in question. So, like it says right there, in 1950s, a group of scientists and doctors, they go to the island to conduct the first birth control trials. Now, one perspective I want to go into this is that because of these women, we have the type of control that we have now. If it wasn't for them, we wouldn't have that. And as women, we really have to thank them for that. They sacrificed a lot. But in that time, there was a lot of misinformation, and doctors and scientists thought it would be a better idea to get individuals who were in low income families, just to offer them a little bit of money and not tell them the whole truth about what was going on. And some women died. A lot of women were sterile, and just situations like these. It happened in the 1950s, but like I said, people don't forget. And this is just one example of medical trials used on people of color and in minority groups. But there are many more. And because of these certain trials, people either died or just other complications issued. And when you say doctor and scientist, in in the person's mind, they're like, okay, you know, this they might be a doctor or scientist, but I don't just having that terminology or just having those degrees makes people not trust them. Can I get the other slide just so I can say it in Spanish real quick? Okay, alrededor de la oh, back. So, alrededor de la década de 1950, los profesionales médicos y científicos llegaron a la isla de Puerto Rico. Y aquí, perdón, aquí estamos hablando de la confianza que uno tiene con la gente que le está dando los servicios, doctores, gente de la comunidad, que no hay confianza. Y una de las cosas que yo estaba diciendo es que la gente que son Latinx y los hispanos no se olvidan. Y este es uno de los ejemplos que estoy usando, right? Esta situación tuve que ver en los años 1950 por ahí, donde unos científicos y un grupo de médicos fueron a la isla de Puerto Rico y llevaron a cabo ensayos en humanos de control de la natalidad, el birth control pills, la pastilla que una mujer se bebe para que no quede embarazada. Pues en Puerto Rico en esos años hicieron un trial bien grande allá y donde había más de 1.500 mujeres que participaron en la droga durante varios años. Había 3 mujeres que se murieron, aunque ellos dicen que pudo ser una coincidence, I'm not sure how you say coincidence, pero que pudo ser por otra cosa. Pero mucha de la gente hispana en la isla pensaron que fueron la pastilla. Entonces también, tras que los años pasaron, muchas mujeres no pudieron tener hijos después de estos tests de los doctores. So, esta no es la única situación, esta es nada más una situación que quise ponerlo aquí, que, que tiene que ver con cómo los médicos y los científicos trataron a la gente que son de comunidades de pobreza o comunidades que no hablan el idioma de inglés y que maybe no saben mucho de lo que está pasando. So, no hay mucha confianza porque cuando una persona hispana ve que alguien es científico, doctor, en verdad esos nombres no le caen muy bien a uno. Puede ser un científico, puede ser un doctor. They're not better than me. I'll do what I know how to do. Porque a veces lo primero que uno piensa también es situaciones que han pasado malos como esto. Can I get the next slide? And I don't know if you were here in the beginning of the webinar, but I had a slideshow and we just had pictures of the women that participated in the birth control trials in the 1950s. Al principio del webinar tenía un slideshow de retrato y era de las mujeres que participaron en este trial del birth control. So although Puerto Rican women made birth control possible in today's age, it was by means of sacrifice on their part, and these cases of mistrust is hard to forget. So in the chat, real quick, I kind of want to piggyback off of anyone else, and I think you could write anonymously, but is there anyone? I know there's people that work at doctors' facilities. I know there's people even here from Puerto Rico that might work at doctors' facilities as well. What other reasons, 2 to 3 words, why the Hispanic and Latinx community might mistrust healthcare providers? I think you can either write it as a question or write it in the chat. Awesome, yeah. So providers don't have a history of working in the communities that they serve. We're going to be speaking about that in a bit. Anyone else before I move on? Awesome. Can cultural, right. So cultural differences. Oh, thank you guys. Poor health literacy. That's a big one. Thank you, whoever wrote that. So using technical terms that individuals never heard. If a Latinx or Hispanic person is already struggling, right? We're trying to understand the language. The doctor or whoever comes out speaking in these medical terms. I took 3 trainings on medical terms and I still don't get it. Can you imagine a person that's already struggling with the language? Prior negative experience with providers not familiar with the culture. And that's a big one. Just because a doctor speaks Spanish, it does not mean that they understand your culture. You guys are awesome. All right, so we're gonna be on the next slides. We're gonna be speaking about the tools that we need and how we could help clients, and if you're a provider, how you could do your due diligence on helping your clients. So what can we do, right? Our health is our responsibility. We cannot expect a medical professional to guess what's wrong. Um, you really have to take responsibility of your own health, right? And I know that is not an easy thing to do, but there are tools that you could use to help you. Nuestra salud es nuestra responsabilidad. No podemos esperar que un profesional médico adivine qué es lo que está mal. So, give me 1 second. So with a client, or if you're not even going to a doctor, if you're going to somewhere else where you're about to get a service, you want to get ready for your appointment. You want to write everything down. You want to write it in Spanish? Go ahead, write it in Spanish. That's okay. When you get there, you want to share your information and ask questions and speak up. I know speaking up for Hispanics and Latino, especially if you're by yourself in a place, it's really, really hard, but it's okay to write everything down, even your questions. If you feel like something's wrong and your medical professional denies to listen to you, or if they don't proceed to the next steps, if you're telling them something is wrong, I want to let you guys know that it is your legal right to ask that medical professional right there and then to write whatever you're saying on your medical history folders. You could even ask for a witness to be present as he's writing that, stating that you told this doctor something and they did not do anything about it. So I just want to put that out there. For example, let's just say you know what? Has anybody seen A Million Little Things? The last episode where I don't want to get too much to worry if anybody sees it and they haven't catched up. A Million Little Things, the show. I told you I was a couch potato. Has anyone seen that? There's a great example. There's a great example of what I'm talking about in one of the episodes there. Gina had some type of concussion, one of the actors in the show. She went to her doctor, she kept telling the doctor, I'm forgetting things. I'm zoning out. I can't concentrate. Doctor's like, oh, you know what? You hit your head. Some things are expected. Um, and Gina so happens to be, thank you, Christine, a person of color and a woman. And a lot of people of color and especially if you're a woman, usually get ignored. So she keeps telling the doctor, I'm not concentrating. There's a lot of things going on. Doctor's like, listen, it was expected. You hit your head, you'll be all right. So Gina's mother steps in and says, you know what? You're going to write that in that folder that my daughter told you that certain things are happening and you're just dismissing it. So that's a great example because that's actually your legal right to put what you need in your folder. Because if anything happens later on, that is written right there. It's your legal right also to have someone come in and verify that the doctor wrote that. Thing is, if you speak up in this way and someone to write that, they don't want that negative feedback. They don't want the next person to know that they weren't listening to you. So they're going to do everything in their possible to get you the help that you need right there and then in order for them not to write it down. So hay un show que se llama Million Little Things y en el show hay una mujer que se llama Gina y Gina se había dado en la cabeza porque estaba en los protests y tuvo un problema con policía, el policía la empujó y se dio en la cabeza. Después de eso, Gina, esto es un ejemplo de un show. Gina se dio en la cabeza, después de eso ella no se pudo recordar mucho, no podía concentrarse, ella fue para el doctor. Gina es una mujer de color y es una mujer, right? So, también en los sitios donde hay científicos, doctores, gente de alta calidad, ellos no le prestan atención mucho a las mujeres y menos a las mujeres de color, right? So Gina le está diciendo al doctor, mira, me duele, estas cosas están pasando, no me acuerdo de nada y no me puedo concentrar. So el doctor le dice, pero si te diste en la cabeza, eso se te quita. So ahí la mamá de Gina vino, no, usted me va a escribir en el folder médico de ella, en la historia médica, todo el mundo tiene una historia médica de un folder. Todos los papeles desde que naciste, se supone que uno lo tenga. En esa situación, lo que la mamá de Gina hizo fue, me vas a escribir en el folder de Gina, y otra persona estaba ahí que lo estaba viendo también, que usted no quiso hacer nada después que mi hija te dijo que la cabeza de ella le dolía y no se podía concentrar y se le estaba olvidando las cosas. So, el doctor rapidito, porque no quiso escribir eso porque eso se ve malo en la parte de él vino y le dio un MRI y hizo lo que tuvo que hacer. So that ended up doing what he had to do after that because he didn't want the bad press after it. So that's just an example, right? So you really want to advocate. And I'm a bit, I do workshops, but I'm a bit of an introvert, not big on conflict. That's me personally. And, there's people out there that don't really like confronting and don't like, it's not that they don't like speaking up and it's not that they don't want to speak up, it's that that's just not in their personality, not in their nature. They just rather leave. So if you know this about your personality, it's best to probably go to your appointment with someone who's a little bit more outspoken, okay? And also, I'm going to give you a number later on. There is every place of service, every doctor's office, every community center has the capability of using an on-call translator, and that is free. You could tell this translator anything, and that person will translate it, to the person that is providing you with the service. También quiero decir que si eso no está en tu personalidad y no eres, you don't like to confront, no te gusta la pelea, es una persona calladito, que es mejor si usted sabe que esto es parte de su personalidad, traerte a alguien que maybe pueda hablar un poquito más fuerte a la gente, right? Y también se lo voy a explicar un poquito más después, pero hay un número donde cualquier doctor, oficina de doctor, cualquier sitio que den servicio o comunidad, hay un número de gratis donde ellos, tú les preguntas por esto, ellos se suponen que llamen y te pueden conseguir un translator, alguien que hable español, cualquier idioma. So, no tienes que ser fuerte. Háblale al translator y el translator puede decirle lo que le tiene que decir a la persona que te está dando el servicio. Next slide. So, acuérdense, cuando vaya para un doctor, un sitio de servicio, van a escribir todo, van a compartir la información con la persona que le está dando el servicio, van a hacer preguntas, hablen alto, quieres tomar decisiones con tu médico y hacerte cargo. Juntos. Esto es algo que para que todo salga bien y lo que hacer juntos con tu doctor o con la persona que le esté dando el servicio. Next slide, please. All right, so we're going to be talking about how service providers can help a little bit, right? If you're a service provider, I want you to take everything that I said in mind. Know that some Hispanic and Latinx people in the community are not confrontational, are not, are more introverted. And this, right, is a chain reaction, or the root cause of it is because maybe they don't speak the language and they shy away from things. I need you to keep all of that in mind, right? And I need you as a service provider to do your due diligence and provide the service. In order to provide the service effectively, you need to do your research. And some of the best, again, ways to do that is get it on the internet. Try to, if you know that a person of a particular culture is going to come and visit you tomorrow, it takes less than 10 minutes to Google the culture and try to learn that way. Again, a little bit goes a long way for a person that's from another country or another culture. So, because Latino communities are so diverse, it's important to know your audience and to use language that they are familiar with and comfortable with. So, debido a que las comunidades latinas son tan diversas, es importante conocer a su audiencia y utilizar el lenguaje que les resulte familiar y cómodo. You want to use certain things, again, that are comfortable to them and familiar. So that could be in the form of conducting an assessment before they arrive, the day before, maybe the week before, so that maybe you can know a little bit more about them and their culture. Make sure to ask them what language they also prefer. Try to have these assessments both in Spanish and in English. And I'm not gonna you got Google Translator for that. The AI on Google Translator is spectacular. Type out something, an assessment in English, put it on Google Translator, and it will give you a good 95% translation. Spanish is weird, and Spanish from Dominican Republic is different from Mexico, from Puerto Rico, and but it's readable, and you could get the message across at least with the assessment form in order to do more research. Improve your ability to engage with your community about issues that are relevant to them. Assess the needs of your local Hispanic communities. Mejore su capacidad para interactuar con su comunidad sobre temas que les sean relevantes, evaluar las necesidades de su comunidad hispana local. There's a lot of Spanish speaking or culturally Hispanic or Latinx community based centers around there. You really want to try to have a list of that, or even try to form some type of liaison with individuals there. Community centers are always searching out and trying to partner up with other people or other organizations just to work better together, right? So you could take advantage of that and try to have a person that's maybe on call from this a particular community center that's part of the culture of the majority of your clients. So, to establish a productive relationship built on the respect Hispanic communities have for families. Para establecer relaciones productivas, construye sobre el respeto que la comunidad hispana tiene para familia. You want to understand that Hispanic families also and Latinx families also have a great respect for their elders. And that's something that we could take advantage of as well as community providers. Can I have the next slide? Direct person to person contact is best when communicating with Latino families. Although, yes, it is best, right? Sometimes that's not the case. And in that case, you want to use your resources that you have from other community, Hispanic or Latino X community based um, people that work there. You want to have that in hand with you. That if you can't do it, maybe they can. El contacto directo de la persona, el contacto directo de persona a persona es mejor cuando se comunica con familiares. Partner with well-respected community leaders to improve outcomes for Hispanic families. As, asociarse con líderes de las comunidades que son respetuosos. So we have a lot of community providers that are community leaders that could help providers as well. You want to take advantage of people that are influential in the community. I know one particular uh, organization that served the Latino community. What they did is that they went to Spanish speaking bars, and usually in the Spanish speaking bars they have singers. Like on Thursday night, they have these well-known local singers or community-based people that people look up to, and they partner with them. So like that, if you were to have an event, you could get this person to try to come and then host or DJ, or even if it's not for an event, it could be for person to person, and people are always happy with an incentive, or if it's part of their job from where they work at. It's just a better relationship that both organizations can have. So I know that a lot of Hispanic and Latino communities do not welcome phone calls. They usually hit that red button. I usually do that too. But a good way to try to reach out to them is through text message. If you yourself, if you even speak Spanish, but your Spanish is no bueno, how you say, or no good, like I said, Google Translator is great. You want to write down whatever you need to convey to your client or participant on Google Translator, and you could text that to them. Let's say you have an appointment for them for tomorrow and you need them to bring certain IDs or certain informations. Put that into Google Translator and translate it to the language that you need, and send it out as a text message. Um, Next slide, please. If I'm looking to the sides because I have a lot of my information written on the side. So the internet and social media networks and YouTube, there's YouTube, Facebook, Twitter, they have new ways of connecting with communities, right? And the thing is that when a person has a if a person has a phone, and usually in this day and age, Hispanic, any individuals have a smartphone. When they get their phone, the phone has the capability of the initial setup, it says language. So that's not just for the text messages. If the initial setup of the phone, if they put it into Spanish, when they get on Facebook, when they get on YouTube, when they get to your website from your organization, it will be in Spanish, or they will have an option to have all the information in Spanish. Just keep that in mind, okay? That if you verbally can't explain something, you want to make sure you have that on your social medias as well, in Spanish and in English. You want to make sure that your website is optimized, mobile friendly, because a lot of Hispanic individuals do not have computers. They rely on their phones for internet. So when they go on your website and it's not mobile friendly, meaning optimized, that all the words are all over the place, if you have a website for your organization, it should be mobile optimized. This will not only help the individuals navigate better on their phones, but it can help them understand what it's trying to say. Next slide, please. So remember we talked about earlier how every facility that provides a service has a capability to have a on-call translator. So I think I found, me personally, I found that a lot of the places that I've seen don't really take advantage of this feature. And some of it, it's paid for by the organizations. So please, I really do encourage people to try to use the service, especially if your organization is paying for it, the translating service, then you should really take advantage of it. If your organization does not have a on-call translating service, the number for the toll-free number, you can use this service for free from the Department of Human Services, is 1-866-872-8969. So, todas las organizaciones se supone que tengan un servicio para que traduzcan de inglés a español. Usted coge el teléfono y hay una persona ahí que tú le dices lo que tenga que decir en español y ellos se lo dice a la persona en inglés. Se supone que todas las organizaciones tengan esto, ¿right? Hay algunas organizaciones que a lo mejor no lo tienen, pero aunque no lo tenga, and real quick, this is for providers and clients. So if your client, you want to take responsibility of your health, and that organization is not offering you an on-call translator, put this number down because this can help you with anything, okay? Y la organización no tiene el servicio del teléfono para traducir. Este número del Departamento de Servicios Humanos es 1-866-872-8969. Esto le puede ayudar a la organizaciones y también a los participantes si necesitan a alguien que lo ayude. And this is for any language, but if you want Spanish specifically, a translator, Spanish to English or English to Spanish, you want to put option 2. And this is live, okay? So you call this number, you get a person that can speak to your client, and the client you could call, and that person could speak live to the doctor. Make sure you write that number down, guys. All right, can I get the next slide? All right, so earlier I said for at least some clients, right, they want to go to where their people's at. So sometimes not, if a client is going to a particular facility, that's fine, but they could also go to another one where it's more geared toward the Hispanic and Latinx community. I think someone asked that sometimes that online that there's not a lot of accurate information. One, the best thing you could do is try to ask the individual a little bit about them and their culture. Two, if you go online and when you find a community organization that's Hispanic or Latinx, they are more than happy to give you all the information, the accurate information that you need. And it's also on their websites as well. I know there's a lot of misinformation out there. The key is to doing accurate research as well. Also, if you go to a particular website, and let's say this website, let's say I go to a website from an organization that's in Puerto Rico, right? To get that information, I could translate it into English online. You have that option on Google Translate. When you put up the page, it should say in the bottom if you want to translate it to English because you're already here in the States and that particularly IP address is from Puerto Rico. So if you get on that on their website and you see that everything is in Spanish, but you're going on this website because you want more accurate information, just go all the way, scroll all the way down, and it'll give you the option to translate it in English. So some of the organizations that are specifically geared towards Latinx and Hispanic is Congreso de Latinos Unidos. They have a health clinic, medical clinic, Esperanza House Center, and the Hispanic Community Counselor Service for Mental Health Services. You could take a screenshot or write these numbers down real quick. And again, not saying that a person has to change. Let's say they're going to Jefferson and all their doctors are English speaking. They could still go there, right? If they're having the translation service, but they could also go over here to community based center that is a little bit more geared towards their culture. And ultimately, it's up to them at the end. They see what best fits them. Can I have the next slide, please? So, how will you advocate for your health, or how have you advocated for a client's health? Just reading over the question. So, this is the end. I do want to make some suggestions. I don't know if I could maybe at the end. I do want to give you all those numbers later on. Make sure if you didn't write it down, just let me know. So again, earlier someone asked if there is a concern that you might have from getting misinformation from a particular website. Again, you have to do your research right, and sometimes the best information or website that you could go to is to the Spanish speaking speaking, or the organizations that are geared to Hispanic and Latinos, their websites have a lot of accurate information. Yes, I can give you the translation number again. I'm gonna put it in the chat. I'll put it in the chat. And again, this is a toll-free number, Department of Human Services. If you're a provider, you could use it. If you're a client, you could use it. I'll write it down in the chat right now. And don't be ashamed to have your phone out if you're speaking to someone and typing in on Google, because it has a little volume thing where you press it and it speaks to the person in Spanish. And like I said, their AI, now in 2021, their AI is very capable of translating things up to 95% correctly. And I'm not saying 95 that a word is 95% correctly, that a word is not what it is. It's the structure of the sentence, because Spanish from different places is different in how they structure their sentence. I'll give you an example in a second. So that's 1-8. I'm gonna write it in the chat. The translation number, it's 1-866-872-8969. Also, keep in mind, if you're an organization or a supervisor, that when you're looking at resumes and you're going to hire your next candidate for whatever position, try to keep that in mind as well, with people that are bilingual. And if you're a person looking for a job and you have a skill that you speak 2 languages, make sure you put that in your resume. It's good to have to diversify your staff. All right, so I put the number on the chat again. It's toll free. It's from the Department of Human Services. 1-866-872-8969. I'm not sure if the number can be called as in three-way. I'm assuming it can. Someone had asked if the toll-free number for the Department of Human Services online translation can be used as a three-way. I believe it can, depending on the phone. If someone's on a cell phone, it definitely can. I'm not sure if I'm assuming they're using landline, but if a client is on a cell phone, you could do it that way as in a three-way call. So there's 3 minutes left, real quick. Um, so someone asked also if specifically if there's any LGBT Spanish information. Make sure I get that. So one of the things that I do is any LGBT nights, usually at least in Philadelphia, and some of them now they have it in your city, where they have like gay Latino nights at the clubs and stuff like that. They have a lot of information on those websites. So when I say, try to do your research online like that, when where you know that they have maybe a Latin gay night somewhere, you want to look into that, or maybe like Spanish gay pride or something like that. Are you looking for specifically in Philadelphia? Right. Kyle Galley has resources as well. Gay and lesbian AIDS education, Latino AIDS education initiative. So Galley.org is GALAEI.org. Guys, it's been a pleasure. Thank you for letting me talk your ears off. I hope you enjoyed the workshop. I hope you learned something. Sorry for the technical difficulties in the beginning, but I hope you got something good and enjoyed it. It's been a pleasure.
Thank you so much, Sky,